Today, we're diving into something pretty special. This is the very first clinical dispatch from the front lines of legal, real-world psychedelic therapy in Canada. So this isn't some sterile lab. This is a look at what happens when this therapy meets actual patients with complex lives. Let's see what that first data really revealed. And that's really the big question here, isn't it? We've all seen these amazing, promising results from highly controlled clinical trials. But, reality is always so much messier, so much more complicated. So what did the first patient data out of Canada actually show? First, let's set the stage a little. For patients with life-threatening illnesses, the psychological burden, we're talking anxiety, depression, that deep existential distress, it's just immense. And frankly, our current treatments are often way too slow or just not effective enough for these folks. This is the huge problem that psilocybin-assisted therapy is really trying to tackle. Okay, this right here highlights a really crucial difference. On one side, you've got your clinical trials. Think sterile, super controlled environments with participants who are screened very, very carefully. But on the other side, you have Canada's Compassionate Access Program. And that's the real world. The conditions are all over the place, the protocols aren't standardized, and you get a much wider range of patients. So how did this even happen? Well, the door was opened by a unique legal tool in Canada called the Section 56 exemption. Back in 2020, this started allowing a small number of patients, people suffering from really serious conditions, to legally get psilocybin mushrooms for therapy. And this report we're looking at, it's the first real deep dive into what they experienced. So let's actually meet the people at the center of this groundbreaking little study. Who were these first Canadians to go through this whole process and, agree to share their data with the world? And the answer is just 8. It's a really small number, and that's so important to remember. This is an intimate preliminary look. It's more of a snapshot than a sweeping conclusion. But wow, what an incredibly valuable first look it is. So, who were these 8 people? Well, every single one of them had a cancer diagnosis, and the group was split right down the middle. 4 were in palliative care, and the other 4 were in remission, but still grappling with the huge psychological fallout. This isn't some abstract study, right? These are real people facing literal life and death situations. All right, let's get right to the heart of the report. The patients were surveyed before their session, that's the baseline, and then again 2 weeks later. So what did the clinical data actually tell us? This chart right here is where the clinical story really comes to life. Each one of those lines, that's a person's journey. They start at the green dot, and 2 weeks later, they're at the orange dot. Now, the asterisks are the key thing to look for. They show that a change was statistically significant. So for anxiety, almost everyone saw a drop. And you can see their quality of life took a pretty clear jump up. So to just boil it down, here are the 4 major positive takeaways. Just 2 weeks after one single session, this small group showed, on average, a significant drop in anxiety and pain. And at the same time, they had significant increases in their overall quality of life and their sense of spiritual well-being. I mean, these results really do echo what the big, controlled clinical trials have been finding. But, and this is where the real-world data starts to get even more fascinating. Despite these pretty profound shifts in their mood and their day-to-day experience, some of their really fundamental beliefs, they remained completely untouched. This is pretty surprising. The therapy didn't actually change their attitude toward death itself. It didn't change their desire for a hastened death, and it had zero impact on any decisions they were making about medical assistance in dying or MAID. So even as their quality of life got better, their core feelings about mortality, well, they stayed exactly the same. That's a really unexpected and important finding. And all of this brings us to a much more complicated picture. See, the reality on the ground isn't a simple it worked or it didn't. The study also looked at what patients were hoping for versus what they actually got out of it. Okay, this slide is absolutely critical. Look at the top chart. It's just full of green. That's everyone's high hopes for improvement. But then you look at the bottom chart, which shows the actual benefits, and it's a lot more modest. There's a lot of gray, which means no effect. And crucially, you see some red, signaling a major worsening for one person in several areas. And it's so important to understand this. Even for the people who had positive results, this therapy was not a walk in the park. The report makes it clear that the session was psychologically challenging for every single person. For one participant, it was actually the single most difficult experience of their entire life. And we have to be really, really clear about the risks involved.
This quote from the study just drives that point home. For one of the 8 patients, the experience actually led to a major worsening of their depression, their fear of death, and their spiritual well-being. It's a stark reminder that without the strict safety nets of a clinical trial, real-world therapy carries some very real risks. So, what do we do with all this information? What is this first dispatch from the field really telling us about the road ahead for psychedelic medicine?
Let's break it down into the key takeaways. First, there is absolutely promise here. The benefits we see in labs can happen in the real world, but there's also real risk. A lack of standardization can lead to negative, even harmful experiences. We also have to remember the context. This is a very preliminary report on just 8 people. And maybe most importantly, it screams that there's an urgent need for formal evaluation programs to track safety as access to these therapies grows. And that really leaves us with the big question, doesn't it? These therapies offer such profound hope to people who are suffering, and that compassionate impulse is driving change incredibly fast. But this first report from the field is a crystal clear signal that caution is just as important. So the question we all need to be thinking about is, how do we build a system that truly honors both?